You have probably been seeing the word Ebola in the news this week. And if you are over 60, you are right to want clear, honest answers. Not panic, not headlines designed to scare you, just the facts, so let me give you exactly that. Here is what is actually happening right now. As of this week, May 2026, the World Health Organization has declared a global public health emergency because of an Ebola outbreak in the Democratic Republic of Congo and Uganda in Africa. This is serious. Cases are confirmed, people have died, but here is what you need to hear clearly. The CDC, the Centers for Disease Control and Prevention, has confirmed that as of right now, there are 0 confirmed Ebola cases in the United States from this outbreak. 0. And the CDC has stated that the overall risk to the American public remains low. This is not COVID. Ebola does not spread through the air. It does not spread through casual contact. You cannot get it from being near someone, from breathing the same air, or from touching a doorknob. Ebola spreads only through direct contact with the blood or bodily fluids of a person who is already sick with Ebola, or through contact with contaminated surfaces that have touched those fluids. This is why outbreaks happen in healthcare settings and in communities with limited medical infrastructure, not through everyday contact the way respiratory viruses spread. Now, what are the symptoms? Because awareness matters. Symptoms of Ebola typically appear between 2 and 21 days after exposure. They begin with sudden fever, severe headache, muscle pain, weakness, and fatigue. This is followed by vomiting, diarrhea, stomach pain, and in more severe cases, unexplained bleeding or bruising. These symptoms look similar to other illnesses, which is why proper diagnosis matters. If you have not traveled to the DRC or Uganda recently and you have not been in contact with someone who has, the likelihood that any of these symptoms are Ebola is extremely low. Now, why should seniors pay attention specifically? Because adults over 60 have immune systems that respond differently to new viruses. After 60, the immune response is slower and less aggressive. This means that if a new infectious disease does spread, and most of the time it does not reach the United States, older adults are always among the most vulnerable. This is not new information. It was true with COVID, it is true with flu. And it is true with Ebola if exposure were ever to occur. So what can you actually do right now? Here is your simple, practical action plan. Step 1. Do not panic, but do stay informed. Follow updates directly from the CDC at CDC.gov and the WHO. These are your most reliable sources. Avoid social media speculation and sensationalized headlines. The situation is serious in Africa. The risk to Americans right now is low. Step 2. Do not travel to the Democratic Republic of Congo or Uganda at this time. The U.S. Embassy has issued a travel advisory urging Americans to avoid Ituri province in the DRC entirely. The CDC has also issued a travel notice for Uganda. If you have any planned travel to these regions, postpone it. Step 3. If you have recently returned from these regions, monitor yourself carefully. Watch for any symptoms, fever, fatigue, headache, muscle pain, for 21 days after your return. If any symptoms appear, do not go to a public emergency room. Call your doctor or local health department first and tell them about your travel history. This allows proper precautions to be taken before you enter a healthcare facility. Step 4. Strengthen your immune system now, not just because of Ebola, but because a strong immune system is your best defense against any infectious disease. Sleep 7 to 8 hours every night. Eat a diet rich in vegetables, protein, and whole foods. Stay physically active. Even light walking 3 to 4 times a week makes a measurable difference in immune function after 60. And make sure you are current on all recommended vaccines, flu, pneumonia, shingles, and COVID, because a body dealing with one infection is far more vulnerable to another. Step 5. Practice strong hand hygiene always, not just now. Wash your hands thoroughly with soap and water for at least 20 seconds before eating, after using the bathroom, and after touching public surfaces. This simple habit does more to protect your health than almost anything else, not just against Ebola, but against dozens of other infections that pose real risk to seniors every day. Here is the bottom line. Ebola is a serious disease. The current outbreak is being taken seriously by WHO and CDC. But right now, today, if you are a senior living in the United States and you have not traveled to Central Africa, your risk is low. The goal is not fear. The goal is awareness, preparation, and a strong, healthy body that is ready for whatever comes. Stay informed, stay calm, and take care of your health every single day, because that is always the most powerful thing you can do. If this video helped you understand what is happening clearly and honestly, please share it with someone you care about, and subscribe for more honest health information every week. As always, if you have any specific health concerns, please speak with your personal physician. Every person's health situation is different. I will see you in the next one. Stay safe.